Hi, I'm Molly Deutschbein. I'm a doula in Rochester, New York. I've been working with pregnant people and birthing persons for almost 30 years, and we find ourselves today in April of 2020 in a really unusual time. How do people prepare to go to the hospital and have their babies in the midst of a pandemic? I'm going to give you some suggestions for making your experience as close to what you were hoping for as possible, given that things are changing all the time. Like I said, I've been working with birthing people for almost 30 years. I'm a body worker, I'm a licensed massage therapist, I'm a doula, childbirth educator, and I also help people who are trying to get pregnant get over fertility challenges. Because I'm a doula, I get to go to all the different hospitals to see how they do things, and I also go to home births. So I have a pretty wide experience of how birth is handled here in Rochester. And one thing that I want to offer you that I hope will give you some reassurance is that most of the tools I'm going to talk about are things you can use in any birth. They're just more important during a time of uncertainty like we have now with the virus still coming to its peak. First, I want to say congratulations. You're having a baby. Just the fact that you are growing a young life inside of you means that you're already resilient and strong and creative. And I want to take a moment to talk about resiliency, or what it's like to be resilient. A resilient person has the ability to walk into a stressful situation, see what's going on, deal with what's happening, and then bounce back afterwards. What can happen to people is that if they endure enough stress over time, they don't have the same resiliency. And just because we are in the midst of this pandemic, that kind of takes people's resiliency down a notch or two. So you may not be as bouncy or responsive and able to just jump back into things as you used to be just a few weeks ago. But what I ask you to do is to think back to a time in your life when you had something really difficult that you had to deal with, and it was a matter of just getting through it one step at a time. There may be times between now and when you are home with your baby when things don't go the way that you were hoping. And that's when I would like you to remember that there have been times in your life when you have been able to deal with difficult things. Remember that you still have that resiliency with you, even though we're going through a hard time, that you are strong, and that you can be very creative when you need to be. One of the best ways that you can stay resilient, strong, and creative is to not get sick with the coronavirus. And the coronavirus enters your body, at least the researchers are saying right now, through your ears, your eyes, your nose, the mucous membranes around your head. So reducing your exposure to other people's droplets that contain those germs is really important. And that's why we're all staying home. So when we're staying home, we also want to make sure that if we sneeze or cough, maybe we have allergies, maybe we're starting to get the virus, that we do it into our elbow or into a Kleenex, and then we throw the tissue away and we wash our hands. Anytime you're caring for someone in your family or someone that you know who's not feeling well, wash your hands. And if you are at the end of your pregnancy and getting close to your due date, in that 2 weeks before your due date and then until you have your baby, you may want to think about staying home, not going out unless you absolutely have to, and staying away from someone who might be sick. And that might mean that you spend most of your time in your bedroom. It might mean that when you go in to use the bathroom, you clean things really well. It might mean that you're washing your hands a lot more. But in order to stay healthy and strong, staying as safe as possible is a big part of that, so that you're not sick when you go to the hospital to have the baby. And that can be really stressful. One of the interesting things about stress is it does give us the opportunity to practice some tools that'll be really helpful when you are giving birth to your baby. Things like noticing that I'm stressed, bringing my attention to my breathing, and then breathing a little bit more on the out breath, breathing in, maybe breathing out for 4 counts, and then breathing in. And that'll gradually help to reduce the stress that you feel in your body. There are lots of other great tools that you can use when you find yourself getting anxious and stressed out because we're living in the time of a pandemic that'll actually help you while you're in labor and while you're expecting your baby to be born. And you can ask if you have a social worker or a caseworker or someone in your doctor's office that helps with some behavioral issues. Ask them for help and ask them for suggestions. You can even go out on the web and look for some good ideas on how to calm yourself using your breath. You also may want to consider asking the person that you are going to have with you at the birth, your birth partner, to try and keep their exposure to the outside world to a minimum for the 14 days before your baby is due. And that is because they're going to be screened at the hospital when you arrive there, and we'll talk about that more in a minute. And you want them to be as healthy as possible too. When you're picking a birth partner, there are some special things you want to consider at this time during the pandemic. They may be in a job where they're exposed to a lot of different people. They may not be able to be away from children or pets or other families for long periods of time. You want to have someone who can come to the hospital and stay with you from when you go into labor until you leave with the baby. This new rule is to help keep the hospital's exposure to coronavirus germs that are outside the hospital to a minimum, so they don't have people coming and going. But that makes it really hard on your birth partner, because once they go into your room and they cannot leave. So you want to have a very, very frank discussion with your birth partner. Is this going to work for you? Maybe you have other children at home that you would prefer your partner stay with, and you would then ask someone else to come into the hospital with you to help you give birth. This is a new wrinkle to this because prior to the pandemic, you could bring, depending on whether it was flu season or not, you could bring more than one person with you. They could come and go as they needed to. But now with these new rules being so strict, you really need to have a long talk about how they're going to feel about having to stay there and not be able to go home and check on other relatives, children, anything else that you've got going on. The other thing that's really important is having a list of alternates, so that if you get to the hospital and the hospital determines as they're screening your birth partner whether or not they've been exposed to someone with the coronavirus, or if they may even have symptoms themselves, if for some reason they don't allow that person into the hospital with you, that you have a set of people. I would recommend 3 or 4 people that you could also call if you needed to, so that you can have someone with you. And I'm going to talk to you about another option that is available to you if you feel that you need someone that you don't even know ready to help you if you need it. So maybe you've been hearing about the infections that people are getting and the fact that they're going to the hospital and that they need special care, and that Governor Cuomo is talking every day about, are we going to have enough hospital beds? It would be understandable as a pregnant person approaching her due date that you might be a little concerned about this. It's okay to ask your care providers and even call the hospital to ask some questions about how they're handling this situation. You deserve to feel safe. You deserve to have your questions answered. Even if you don't have any choice about where you're going to give birth, these are real concerns. And part of your job as the birthing person is to find out all that you need to find out so that your body and yourself can feel safe. You want a body and self that feels safe so that you can allow your baby out into the world when you give birth and not feel like you've got to keep baby inside. So it's an important part of being a parent to ask questions and find out lots of information. And so you're having this wonderful opportunity to ask your care providers, call the hospital. You probably can't tour the hospital right now. So you can call and ask them questions. If you have concerns about, so as a laboring person at this time, what happens if the hospital becomes full of coronavirus patients? What will those coronavirus patients be anywhere close to where I'm having my baby? Can you tell me that they're not going to be anywhere near my baby? And how are you disinfecting the rooms in between when one person gives birth and another person gives birth? If you're the kind of person who worries about these kinds of logistical questions or how things are getting cleaned, it's okay to ask them. And if you're the kind of person who's like, oh, that stuff I'm not worried about, it's okay, you don't have to. I just want to make sure you understand that your care providers and the hospital should be prepared to answer your questions in ways that you understand and feel good about so that you can go into your birth feeling confident and resilient. When you get to the hospital, you and your partner will both be screened for coronavirus symptoms. Generally, what they're looking for is coughing, sneezing, and temperature, and the screener will ask a series of questions about whether or not you've been exposed to anyone that has the illness. One of the things that may happen as more and more people get sick in our area is that the hospitals may move parts around. Maybe if you gave birth 2 years ago, the triage won't be in the same place, or maybe they've moved the birthing units to a different area to help keep you and your baby away from the coronavirus patients. Just know that things are going to be unusual, and they may be a little more stressful. There may not be as many nurses as there ordinarily would be on the floor. Everyone's doing the best they can do, and just keep deep breathing through the whole experience. And don't be afraid to remind your providers to wash their hands, to wear masks, to change gowns. It's always okay to remind them. Whether it's a pandemic or not, it's always okay to ask the person who just entered your room, did you wash your hands? That's something that we've been told we should be asking our care providers for many years, and now it's particularly important. You may have lots of questions that are also about what happens when you're in labor. No matter what kind of birth experience you planned for, because everything is up in the air, you may find that what you learned in your childbirth class isn't quite the same here. For one thing, we used to offer, the hospitals used to offer nitrous oxide as a way of dealing with pain management, is the laughing gas that you breathe in. Well, with the virus pandemic, that's not a medication that works. It's too easy to spread the germs around, so they're not using that anymore. Perhaps you learned in your childbirth class that you should be walking the halls, that you might go into triage and they'll have you walk around if you're not dilated enough, and then you can go into your room, or you're going to go into your room and you're going to stay in your room. That's what we've been told. So that's a little different. And other things may change as they're trying to keep you and baby safe. So what we encourage you to do is to use your brain. And that's just a way to remember It's okay to ask your care providers if they want to do something differently than you expected. What are the benefits to their suggestion? What are the risks? What are the alternatives? In other words, is there something else? It's amazing what doors open up for you when you say, well, is there anything else we could do? How does your intuition feel about that? What does your body tell you about this information? And then what happens if we do nothing? Are there any risks to doing nothing? It's okay to take your time. There's always enough time to get informed consent, to use your brain, to understand what your care providers are telling you and make good decisions. Again, this is part, if you're going to be parenting this baby, this is part of a lifetime to come of making good decisions that require time and information and getting to a place where you feel good about it and safe in your own body before you move forward. And it's okay for you to take the time to do that. So what if you do get infected with the coronavirus? Remember that 80% of people who get the coronavirus, according to the latest statistics, they don't get terribly sick. They may feel nothing at all, and if they do feel sick, they just feel sick, but it's not the kind of hospital requiring kind of sick. So you don't need to be afraid of getting the virus itself. However, if you do have the virus while you are in labor, that means that you will be going into the hospital while you're actively sick. And so the hospital is going to want to make sure they know that you're one of the people who have the coronavirus. And that means they will take you to a separate part of the hospital where they're caring for other pregnant people and birthing people who have the coronavirus. And you will have to deal with people who are all suited up so that they don't contract the virus. They don't want to get sick. So they'll be wearing masks and special suits and boots and maybe some special gloves. They're going to look a bit like space aliens. They may have your partner dress up that way too. This will be very strange and certainly not what you were dreaming about for your birth experience, but it's all part of trying to keep you, your baby, your partner, your care providers, and the rest of the hospital safe. And just keep telling yourself, in a couple of weeks, I'm going to feel better. I'm going to be home. I'm going to be holding my baby. My life is going to move on to all the dreams that I had of what life after pregnancy was holding for me. In the midst of it, if you're sick, it might take a lot of deep breathing to get through it, but you will, because you're resilient and you're strong and you're creative. It's also really important to know that according to the World Health Organization, all women have the right to a safe and positive childbirth experience, whether or not they have a confirmed coronavirus infection. This is important to know because sometimes when hospital administrators get frightened, they want to simplify things. But it is your human right to have someone with you, even if it isn't someone that you know. So let's say your chosen birth partner is also sick, so they can't come in with you. You still have the right to have a person with you. You will have a labor nurse and you will have your care providers, but you can also reach out to more of your friends and family until you find that one person, or you can reach out into the community. Your care provider, your caseworker, one of the people where you're getting your prenatal care may have some ideas for you of suggestions of people who could be there for you if you don't have, if your birth partner gets sick or you don't have another family member that you could ask. And I'm also going to give you an email address where you can ask for virtual doula support too. But you have a human right to have someone with you, whether or not you are sick. Also, after your baby is born, you have a choice, and that is to keep your baby with you or to have the baby go to the nursery if you have the coronavirus. So after baby is born, particularly if you're going to be breastfeeding, the World Health Organization really encourages women to keep babies rooming in with them. And there's just some basic hygiene that you need to do to keep babies safe. But particularly if you're breastfeeding and you have colostrum, which is the early breast milk that comes right after baby is born, that is full of immune system strengthening substances that will help to keep baby healthy. But it's also okay to choose to send baby to the nursery if you feel that would be a safer alternative for your baby. Again, as your baby's parent, this is one of the first decisions that you'll make for your baby's own good. But know that it's your choice. It's a choice that you get to make. So several times I've said that I'm a doula. A doula is anyone who goes with a birthing person to their birthplace, whether it's in their home or at their hospital, and accompanies them through the birth and gives them suggestions for how to stay comfortable. Maybe it gives them some additional information if they're trying to make a decision, and generally supports them and their partner, making sure that all the stuff comes in from the car and grabs them snacks. Make sure that the partner takes a break and goes to take a nap, that sort of thing. A virtual doula is something that has become more popular since this coronavirus pandemic started, and that allows the doula to be present with the birthing people over the phone or an iPad, FaceTime, or Zoom or Skype, checking in and generally doing the same thing, making suggestions, cheering people on, giving information when it's needed. It's not the same as having a doula in the room, but right now we can't be in the room unless we're the only birth partner with the birthing person. And often the birthing person wants to have a family member or their partner with them instead of the doula. Sometimes people choose the doula first because the doula's got more practical ideas. It really is a very individual choice. But you can also have someone on the other end of the phone with you. And again, it doesn't have to be a professional doula. It can be family members. It can be friends. People who know about birth. People who know about you and what helps you feel comfortable and safe while you are giving birth to your baby. Again, you may encounter some additional stress with this pregnancy and this birth because we're in the midst of a pandemic. But having someone that you can call who can help you breathe, who can give you suggestions for how to move and what positions to be in, that can be really helpful and a wonderful resource to you, especially if your other partner is starting to get tired or hungry because they haven't been able to leave the room since you got there and they just need to fall asleep for a while. Make sure you can phone a friend, your own virtual doula. And if you're not sure where you can find a family member or a friend, you can send an email to virtualdoularequest@spiritorganic.net, and I'll help to pair you up with someone so that when you go into the hospital, you'll know that you can call someone for help if you need it. If you find that you have the coronavirus at the time that you give birth to your baby, you can still breastfeed your baby if that's the choice that you've made. And then after the baby is born, you will be given another choice, and that is whether or not to keep your baby in the room with you. If you're breastfeeding, it can be very convenient to have the baby staying with you, and you can still do that even if you're sick. You can wear a mask and wash your hands, and baby will be in a separate isolate, a little bed next to you, but you can keep your baby with you if that's what you like. You can also choose to have the baby cared for in the nursery if that's what feels right to you. But the staff can't tell you the baby has to be removed from you. The staff must give you a choice as to whether you'd like to keep the baby in the room with you where you can breastfeed easily, or if you would prefer to have the baby cared for in the nursery. Then when you go home, put some thought ahead of time into what that's going to be like. These are strange times. Most of us are staying in place, and the people that we live with are the people that we're stuck with. So maybe you live alone. Maybe you live with your partner. Maybe you live with your extended family. So the question is, does any of that extended family or your partner, do they know how to support you as a person who has just given birth to a baby? Traditionally, when we give birth, we can reach out for a lot of community support. Sometimes we're fighting people off because they want to come and visit us so much. But at this particular time, it's very possible that you will go home to a place where you will either get lots of support or you will get very little support. So thinking ahead to who can you talk to if you're having trouble feeding your baby, whether you're breast or chest feeding or you're bottle feeding. Who you can talk to if you're not getting enough sleep and you're worried about why your baby's not sleeping. Who you can talk to about yourself and how you're recovering postpartum from the birth. You know, what kind of bleeding is normal, what isn't, what kind of pains that you might be experiencing from a surgical scar, a surgical incision, or from your bottom after the birth. You want to make sure that you have people you can reach out to and ask questions of so that you can keep an eye on your own recovery. And then looking for signs of anxiety or depression. Postpartum anxiety and postpartum depression occur in a small number of people after giving birth, but in this particularly stressful environment that we're in, where you may feel alone and isolated or living with people who aren't particularly supportive, you may find that you're a little more prone to feeling anxious and depressed in the midst of all that's going on. I hope for you that you find yourself in a very supportive environment with people to cook and clean and love on you and love on your baby, and that's fantastic. That would be wonderful. But if you find that that's not what's happening for you, make sure you know who you can call. Ask your care providers, hey, if I'm having trouble after this baby is born, who can I call for help and support, and get some names from them. One of the things that it's really helpful to know as a parent of a small crying being is how to create your own safety. The more you're able to create a sense of well-being in yourself, the more you're going to be able to communicate that to your baby. In our professional world, we call that co-regulating central nervous systems. But we have that ability as people. When I'm calm, then I may be able to help my client that I'm working with feel more calm. When I'm feeling really revved up and unable to calm down, it's very hard for that other person who's with me to feel calm. They're gonna be like, whoa, what's going on with her? And the same is true for our children. It's not that we always have to be calm and cool. That certainly wasn't how I was with my children as they were growing, or my babies. But when I could come into a calm space, take a couple of deep breaths, if they were still having whatever tantrum or big feelings that they were having, at least it was just them who was having them, and it wasn't me also in the midst of a whole bunch of big feelings. I used to joke that it was always nice to have at least one grown-up in the house at a time. So think about what helps you feel safe and cared for. That's going to help you when you go into labor, and that's going to help you when you're home with your baby. And think about who you can talk to, who you have in your life that helps you feel calm. Who is that person that when you're talking to them, either on the phone or in person, or if you go for a walk with them, it helps, just kind of helps you slow down and relax a little bit, and everything seems to make a little more sense. That's a person you want to reach out to after you have your baby and you need to make sense of things. That's a good resource for you. So lastly, I just want to tell you congratulations. This is a big adventure that you're about to go on. Giving birth all by itself is an amazing experience and a way of learning about yourself and your own resources, your own resilience, your creativity in ways that you've never thought about it before. And in this particular time, where you may be asked in the moment to adjust what you thought was going to happen, and oh, something different is going to happen, and process that and come to a place of feeling okay with it while you're in labor. It's a big thing. It's a really big thing. But it's also excellent preparation if you're going to be parenting this child for how that works with kids. There are always surprises. There are always things that we did not expect that we have to figure out. And you are an amazing, creative, confident, strong, resilient person. And you're going to get through this experience one breath at a time. You're going to be amazing. So congratulations and enjoy the ride. Thank you.